Hello. A man pulls the sheet up to sleep, a gesture you make every night without thinking. The fabric touches his back, and he freezes. It's not cold, it's pain. The wound he had there on his back is gone, months ago. The skin closed, scarred, nobody sees anything anymore. But there's something that hasn't gone away. First, he stopped sleeping lying down, then he stopped leaving the house. The family thought it was old age, fussiness, old man stubbornness. It wasn't. It was a pain that nobody could see, that didn't show up in any exam, and it slowly pushed him into a very dark place. The wound had healed, so why did the pain continue? And why did it almost take away his will to live? And the worst part? It could have been avoided. It has a name. Shingles, Herpes zoster. It's the same thing. I'm going to take you through this whole story, what it is, why it hurts, and a simple action that protects much more than just the skin, heart, brain. Stay with me. You'll be surprised. Before we begin, do me a quick favor. Comment below. Have you ever had shingles? Or do you know someone who has? And where are you watching from? Let's go. Herpes zoster, or shingles, isn't a new infection you just caught. No, it comes from the chickenpox you had as a child. That chickenpox, or varicella, that almost everyone had. I had it when I was little, and I remember it well. The blisters, the itching, the fever for a few days. I got better. You got better. But the virus didn't go away. It never goes away. Think of your body as an old building. All the wiring is there, hidden inside the wall. And this virus, after the chickenpox, did something silent. It walked backward, entered the root of one of your nerves, right next to your spine, and turned off its own circuit breaker. It's there now, in the dark, asleep, for 30, 40, 50 years. While you work, get married, raise your children, grow old, it stays there inside, waiting for the light to flicker. And the light flickers on the day your defenses fall. It could be age, severe stress, an illness, a life-changing event. Has your immunity dropped? And then it wakes up. It flips the circuit breaker. It descends inside the nerve to the skin, and it explodes in a band of blisters on one side of the body. And yes, many people ask, is it contagious? It does cause something, but not what you imagine. Now I'm going to debunk two lies you probably believe. First, shingles is caused by cold weather. It's more common in winter. It's not the season. The trigger is your weakened immunity, and this happens all year round. Second, and this is the oldest of all, if shingles wraps around the body and the two sides meet, it kills. Myth. Pure superstition. Shingles follows only one nerve, on one side only. It almost never crosses the middle of the body. It's not the wrap that kills. The real danger is something else, and it's much more serious than this soap opera story. And it starts hidden, before you see any marks on your skin. Shingles doesn't warn you with blisters, it warns you beforehand. 3-4 days before anything appears, the virus has already woken up and is already eating away at the nerve. At this stage, you only feel a strange burning sensation in one spot. And this is where it deceives you. If it's on the left side of your chest, the fear is total. I'm tired of seeing people arrive at the emergency room thinking they're having a heart attack. They do an EKG, nothing shows up. Days later, blisters appear, and everything makes sense. But the virus has already gained a head start, and it's because it descends inside a nerve that it hurts like this. Because this isn't skin pain. Write this down. Shingles isn't a wound, it's an inflamed nerve. And this is where this virus shows how treacherous it is. It's patient, it's opportunistic. It won't go to your lungs, it won't go to your stomach. It attacks your body's alarm system, your nerves. You must have woken up one day when a car alarm goes off in the middle of the night, out of nowhere, and nobody can turn it off? That's what it does. It strips the nerve fiber, like an electrical wire that has lost its insulation, and triggers the pain alarm at maximum volume, straight to your brain, even without any burning sensation on the skin. And then the pain comes in a way that scares those who have never felt it. Burning, shock, stabbing, as if someone touched a hot iron and gave you a shock at the same time, in the same place. But there's a part of this pain that's almost impossible to explain to someone who has never experienced it. Its name is allodynia. It makes the lightest touch hurt. The sheet brushing against the skin, the shirt, the bra strap, a breeze on the arm. Things that shouldn't hurt at all become torture. I've treated people who slept sitting up, who wouldn't let anyone touch them, who took off their shirts when they got home because the fabric on their skin was unbearable. And now comes the fact that changes everything. In a large percentage of people, and the risk increases significantly after 50, this pain doesn't go away when the wound closes. It stays. It becomes a chronic pain that can last for months, sometimes years. We call it post-herpetic neuralgia. And now you understand the man from the beginning. It wasn't stubbornness. It wasn't fussiness. It was real, invisible pain, without any wound to show the family. A pain that steals sleep and slowly pushes the person towards depression. It's one of the most unbearable pains known to medicine. And it doesn't show up in any exam. Look at the warning sign. If the pain continues for more than 3 months after the wound heals, it has a name and a treatment. Don't accept being told it's all in your head. See a doctor. Even better would be to see a doctor. It's quick, as soon as you start feeling it. There's a window we call the golden window, 72 hours. 3 days from the moment the blisters appear. If you start the right antiviral within those 72 hours, you slow down the virus, shorten the illness, and help reduce the chance of that invisible pain becoming chronic. The mistake I see most often? People think it's an allergy. They apply some random ointment. They wait for it to go away. When they finally see a doctor a week later, the blisters are already drying up, but the nerve damage has already been done. And then the medication no longer has the same effect. But chronic pain isn't the only danger. There are 3 even more serious complications. And the third is the one that worries me the most. First, the eye. Be very careful here. If shingles appears on the forehead, near the eye, or on the tip of the nose, it's a red alert. The same nerve that passes through this region enters the eye, and the virus can cause severe inflammation of the cornea, retina, and even the optic nerve. The result can be devastating. Scars that blur vision, increased intraocular pressure, glaucoma, retinal destruction, and direct damage to the optic nerve. In some cases, vision loss can be rapid and permanent. Remember this rule: shingles blisters near the eye are a medical emergency. Don't wait. Seek treatment the same day. Second, that question that lingered earlier: is shingles contagious? Almost everyone gets this wrong. You don't transmit shingles to anyone. But the fluid from the blisters contains the live virus. And anyone who's never had chickenpox, a child, a grandchild, someone with a weakened immune system, can catch chickenpox from you. Not shingles, but zoster. Chickenpox. That's why, with an open sore, stay away from babies, pregnant women, and anyone with a weak immune system. And the third thing, what nobody tells you. In the weeks immediately following shingles, the risk of heart attack and stroke increases. It really increases. There are studies showing that in the month following an episode, the risk of stroke almost doubles. Why? Because the inflammation doesn't just stay in the nerve. It affects the blood vessels throughout the body. It inflames, irritates, and helps form clots. You can't sleep because of the pain. You get stressed. As a cardiologist, that's exactly what sets me off. Because a skin disease that ends up clogging an artery becomes my problem and your problem. And if you have a father, a mother, a friend over 50, this information stops being a YouTube video. It becomes a shield. Send this to that person now without pausing the video. Because now comes the part that almost no one tells you, the part about the brain. And the turning point begins with good news. It's possible to avoid almost all of this. There's a vaccine against shingles. The newest version, its name is Shingles, offers about 90% protection against the disease. And, more importantly, it also protects against that chronic pain. The kind that doesn't go away. That alone would be worth the whole video. Avoiding the pain. Avoiding the depression of the man from the beginning. But then the scientists noticed something that nobody was looking for. Something that has nothing to do with skin. Those who took the vaccine seemed to have one less problem. And it wasn't just any problem. It was one of the biggest fears that exists after 60. I'm sure you're afraid of losing your memory, right? Well, listen carefully. The story is interesting. The proof came from an accident, from a lack of vaccine, from a line that someone drew on a calendar in a tiny country called Wales, and it separated two lives that were almost identical. It's the closest thing to a lottery that science can do without conducting a real experiment. And what it revealed is chilling. 2013, Wales. The government is going to start vaccinating the elderly against shingles. But there's a problem. There aren't enough vaccines for everyone at once. So they make a cold, bureaucratic choice. They will release them by date of birth. They draw a line on a single day. Anyone born from that date onwards can get vaccinated. Anyone born a little before can't, and never will again. It's heartbreaking. The line they drew was just one day, September 2nd, 1933. Born before the first? Left out, forever. Born on the second? Included. Now you think about the magnitude of that. It's as if two neighbors with the same age, the same health, the same life were separated by a single day on the calendar. One born the day before, the other the day after. One group was left out of the vaccine, the other was included. Nobody chose anything. It was a stamp on a government document that fell on one side or the other of a line. And researchers at Stanford University looked at these two groups 7 years later. The group that was able to receive the vaccine had overall about 20% fewer cases of dementia. 20% less, 1/5, just because of a shingles vaccine. Now pay close attention. There are 3 things that almost nobody tells you. First, the vaccine in that Wales study was the old one, the first generation. It's not exactly the same as today's. Today's vaccine, Shingles, is even better, and another study suggests that it may protect the brain even more. Second, the effect was much stronger in women than in men. Why? Nobody knows for sure. Women have twice as much dementia as men, so if you are a woman, this video is for you. And the third, a caveat. This is an association, a powerful clue, but it's not yet definitive proof. The scientists themselves are asking for a real test to confirm this. And look, the vaccine is recommended to prevent shingles. This rest is a bonus that science is still investigating. And it wasn't just one country's luck. It was repeated in England, right next door. And the benefits didn't stop there. Look at the newest chapter, from the end of 2025. Among elderly people who already had dementia, those who were vaccinated had slower progression and fewer deaths from dementia. The vaccine seemed to do more than delay its arrival. It seemed to hold the hand of those already on the path. Put it all together now. Go back to the beginning with me and look at the size of the impact. The same vaccine, just one. It appears linked to less dementia. It appears linked to fewer heart attacks and fewer strokes, less pain, less blindness, less stress. There's a large study with more than 1 million people showing up to 23% fewer heart and brain events. And of course, it prevents the depression and darkness that almost took humanity from the beginning. So when I look at this vaccine, I don't see a skin disease. I see prevention of the heart, of the brain, of a pain that doesn't show up in any exam. And it's here that the man from the beginning, his pain, his fear of dementia, the risk to his heart, all of that ceases to be a loose subject and becomes a single question. A question you take to your doctor at your next appointment. It's not my prescription. I'm not here to tell you to take anything. Recommendations suggest vaccinating from age 50, and for those with low immunity, sometimes earlier. But the decision is yours, with your doctor, looking at your history. The question is simple. Doctor, with my age and my health, should I have already had the shingles vaccine? Write that question down. Take it to the doctor's office. It could be the most important conversation of your year. And the man from the beginning? Could his pain and the darkness that came with it have been avoided? Today, you know the answer. Tell me below, have you ever had shingles? Or did you only discover today that this vaccine exists? Write, I've had it, or I didn't know. What's the most surprising information from the video? I want to read it. And look, everything we saw today in the end leads to one place, the brain. And if it suddenly fails, you have minutes.